Community paramedicine and community paramedics in general is a newer field of pre-hospital emergency care. What a community paramedic has additional training in is the nuances of things and truly what is best for that community. So a community paramedic in our area in northern Teller County and Woodland Park area is very different than a community paramedic even in Denver.
Here in Woodland Park, oftentimes we have underserved, underprivileged patients who don't have access to cars or vehicles, and they're seeking help or medical care. In our healthcare system up here, our community paramedic can drive out to their house, meet with the patient in person, and then connect them with a physician through Pulsara. So somebody who has zero access to healthcare, has no way to obtain a prescription, is able to meet with a community paramedic, connect with a physician through Pulsara, and receive healthcare.
We are in a SUV, we're by ourselves, so we can do basic lab blood work, we can do UAs. If we deem that the patient needs medical attention but not necessarily by an emergency room, then we would call the doctor on a tablet and we would do a face-to-face with the doctor and then with the patient. And then that doctor can prescribe medications. If the patient doesn't have a way to get to the pharmacy to get their meds, then we can go pick them up for them and bring them to their house.
We're bringing back the physician's house call in an extremely powerful way, like it's never been done before, and brings the world right into that patient's home.
If we want to get a cardiologist on, an obstetrician, the patient's primary care physician, we can actually get all of those people to actually manage that patient at the same time.
The UPRAD community is amazing because they support the school district. They're one of our really good partners. The telehealth part, that crisis can be solved in that moment.
Pulsara uniquely ties together all the members of our community on one platform and one channel, all the way down to the basic EMT who arrives first on scene, to a cardiologist in a cath lab at a major trauma center.
We can contact the hospital and let them know and give seamless care with that patient going directly from their home all the way into the hospital setting. When COVID-19 and the pandemic started, we realized a true need for needing telehealth within the community. Pulsara really stepped up, said we're working on a platform.
We approached Pulsara, we said, hey, we need a telehealth platform that's easy to use, easy to install, and they quickly developed this amazing platform.
We came together, it worked great, and we're able to roll out a full platform that we were able to go out and provide care directly in patients' homes.
They're not just clients, they're people that I grew up with. My grandmother lives within the community, and I've been able to refer her to the community paramedic program. And along with Pulsara, we've been able to find her new doors and new pathways to pursue to better care.
I'm super excited as we leverage Pulsara in our communities, both in the city down in Colorado Springs and up here in the rural communities in Woodland Park. It's simplifying healthcare for us.
Solving a community need that has never been solved before in pre-hospital care, and this lets us fill in that gap and help those people right within their home.